Alberta, we had the real opportunity with the amalgamation of 9 different health regions, they were called back then, into one organization called Alberta Health Services. And having the start and the formation of a department called Patient Experience allowed us to look at how do we get patient-centered care across the province and patient engagement across the province in order to improve the patient experience. Well, it terrified us when we looked at the formation of this department, and I was given the challenge of, yes, you are responsible for the province to bring the voice of patients throughout the organization. What I was very hopeful about and knew was that throughout this province we have wonderful pockets of people who get patient engagement, who get patient family-centered care. And so we weren't starting from zero, but we were starting in some areas where patients and families and providers were maybe what you would call disengaged, that they were a little bit jaded with the system and jaded with what was happening. When we started to work with areas that would phone us up and say, we want patients right now, we need some patients right now, we're going to be having this committee, we're going to redesign our department. Sometimes they knew the right thing to do was to have the patient and family voice there at the table, but at the same time, they didn't know how to get that patient voice, and they were afraid to actually have patients and families come to the table because they didn't want the patients and families to see the faults of the system. And so one of the things that we've had to work through is a fear that it'll all just be negative. What the staff soon learn is that it's not. It's a very positive experience to patients involved. And we think of things in hierarchies and departments. Right? It's, I work in this department, I work in addictions and mental health, I work in cross-cultural services, I work at the Alberta Hospital. But from a patient's perspective, they actually see their journey through our systems as one big giant journey. And what they don't understand is why sometimes we aren't all connected. We realized from the get-go that if we didn't have staff and leaders on board with understanding what patient engagement was, but also understanding what actual staff engagement is as well, then it's going to be very, very hard for our staff and leaders to connect with patients and families if they themselves don't feel connected to the work. We wanted to improve the patient experience. We wanted to engage more with patients, but we knew that we didn't have tools and resources at our hands. We were kind of flying by the seat of our pants.
Our objective was to find out from patients, healthcare providers, and leaders what they felt they would like to see happen with patient engagement, what they needed in terms of resources or maybe capacity building, and put together a resource kit that would help them. The readiness toolkit for us was, I think as soon as we actually had developed it, and even before we had released it and shared it with our steering committee, there were many people who were eager to get their hands on it. The less prescriptive, the easier it is for people to adopt it.
And what's really exciting about that is our consultants are taking pieces of that resource kit and using them now. And then they're adding other pieces as they do other work across the organization, and they go, you know, the kit doesn't have this in it yet, and we just got asked about this, this, and this. And so our resource kit continues to grow all the time because we're using it continually now and being tested. So it's very, very exciting. My department will get somewhere between 10 and 20 calls a week for we want patient advisors and we want them now. And then they want the voice of the rural, and they want the voice of people from different cultures, and they want the youth voice. So how do we get that voice? How do we get as wide and diverse of a voice as possible? We do have to seek those other voices. One of the biggest things that we've learned is that you have your support for your patient advisors. Unless you assign a person to mentor that patient advisor, and for those first few meetings, until that patient advisor is comfortable speaking up in that atmosphere and environment, that you make sure that you have a person that they have as a go-to person. What we have learned from our patient advisors is that you don't bring the patient voice in to just rubber stamp something, because that is not where our patients and families want to be involved. And they consider that tokenism, and they're actually very offended by that. So it again, it comes back to that very basic thing of respect. and understanding. And the staff vacancy rate has gone from 7.5% to actually having a wait list now. My key message for other people looking who may just be starting the journey of patient engagement or the journey of patient and family-centered care is that there is no simple way, black and white prescription or framework that you can follow to get it the right way to actually hear that patient voice. But what I would tell people to do is to just start. To just start where you are and remember that it is a journey, and every single patient advisor will give you a different perspective. And so each one is unique and we can learn from everyone.